What are the core services? What are the professional core services by law? Professional management by whom? Nurses, right? Say it again. Okay, so what the regs actually say is that the 4 core professional services are physician services, nurse services, medical social work, and what they call counseling. Counseling includes spiritual care counseling, but it also includes bereavement support. Now, most hospices have elected to view the counseling requirement as meaning pastoral care as a core, part of the core interdisciplinary team. In fact, that's probably everyone. But what the regs actually say is that they put that into a larger framework called counseling. What else is included in the benefit? So you have to have professional management by an interdisciplinary team that consists of at least those 4 people, those 4 specialties. Yeah. Yeah, so DME, supplies, and all drugs and biologicals related to the terminal illness. What else?
Care planning. I don't know how they say it, but you have to meet and discuss the plan.
Right, so professional management that leads to a coordinated care plan. But in terms of the services provided, we have physician, nurse, social worker, counseling, including pastoral care included. We have what other people have to be involved or have to be available? Volunteers, mandated by law. Isn't that interesting? There's no other benefit in healthcare in the United States that mandates volunteers. It's the only one.
Does it mandate what they do?
They have to volunteer. But they mandate that they have to be trained. So the law says you have to train them, and then what law says you have to have them. Very interesting, right? Home health aides, mandated. Right? Access to dietary guidance, access to speech and swallow guidance, access to physical therapy and occupational therapy. If you can't provide access to these things, you have to get a waiver from the government. But you can't get a waiver for the core services, physician, nurse, social worker, pastoral care. That's required.
And how about inpatient unit availability?
Yes.
Can we get a waiver on that?
So you have to provide access to all the levels of care. So what are the 4 levels of care in hospice? Routine home care. RHC, routine home care. 80% of your patient days have to be RHC. What else? Respite care. What is respite care?
The caregiver burden,
So it's 5 days in an inpatient setting so that the family can get respite.
5 days in how many days? Like, how many times they can get 5 days?
That's a good question. I don't know the answer to that. See that? That's a nuance I have to now look up. I've been doing this for 7 years, looking up the nuances. Anybody know how many respite periods you have?
I've heard it's 1 per certification period.
Yeah, well, that would make sense.
Yeah.
But again, it's a
Per 3 months. It was like that.
well, 1 per 3 months would not correspond with what Laurel said. So Laurel thinks it's 1 per cert period, and Dr. Ede thinks it's 1 per 3 months. And since neither of you know for sure,
So there's 2 cert periods. We have 2 residents.
okay. Why don't we all agree we'll come back together in a year here, right before Thanksgiving next year, and I'll tell you what the answer is. Or you can Google it. There is something called the Google machine, and you could put in a question, and they will tell you. So access to routine home care, access to respite care. What's a 3rd level care? Continuous care. What's continuous care? 24/7 in the home. Now, by the way, as far as hospice is concerned, nursing home and home are the same. Nursing home or residence is where you live. It's a home. So continuous care is 24/7 care by a nursing professional, and hospices have to provide continuous care. What about the last level of care? That's where we work. GIP, General Inpatient Level of Care. What does General Inpatient Level of Care mean? What justifies us telling Medicare that we're bringing a patient in the hospital for GIP level. Say it again? Best managed. Well,
Can't be managed in the home. Would be a good way to say it.
so the way that they would think about it is there's a need for skilled nursing or a need for medical services. So it's actually very much the same as Part A, general hospital billing. It's what your DRG. It's like having a DRG, but instead of having a DRG, which is a bunch of money linked to a diagnosis that covers a certain number of days during which the government says you should finish taking care of that patient's medical needs, we actually get a per diem, but the government says you're only going to get the per diem if the patient has those medical needs. So it's skilled medical needs or skilled nursing needs, access to those required. And so they say for symptom control, and what we say, they say unrelieved symptom, we say unrelieved symptom or complication of disease. So a patient has to be admitted to the hospital for skilled nursing or medical input for a symptom control need or a complication of disease. What's the second reason that they can be GIP? Active dying, right? Actively dying. So these are important, as we'll talk about in a second, in terms of reimbursement. Okay. So what are the venues of care? So the levels of care: routine home care, continuous care, respite care, GIP level care, 4 levels of care, 4 different per diems set by the government, depending on where in the country you live. Documentation requiring evidence that the person is appropriate for those levels of care has to be in the medical record. Right? If a patient is in our hospital here and we can't discharge the patient and they don't have an uncontrolled symptom or they're not actively dying, we are required by law to change the billing on that patient to routine home care. The patient is then in a hospital bed and parenthetically costing the hospice the rental of that bed at a hospital rate, but the hospice program is only billing the government for the routine home care. What's the routine home care per diem in New York here? Anyone know? Say it again. Around 167, I've heard. It changes all the time, but say 167. Do you know what the GIP per diem is? 785. So if you're a hospice program and you have to pay 7 something to the hospital to rent that bed, but you're getting 167, who counts beans here? The math doesn't work. So it's something you don't really want.
Those rates change only if there's a problem, like with, like let's say a disposition, if there's symptoms control. Does that cover the whole hospital course or just that period?
Just that period. Just that period. Yeah, we have. It is the obligation of the hospice agency to bill based on the level of care and to document that. Okay, so venues of care, we already said, in the home, which can be in a nursing home or a hospice residence, in the hospital, in an SRO.
For the exam question, so you have a patient, there's a patient in prison, and he's dying of terminal cancer, and the question is, can you provide hospice care? There are options.